Good morning, everyone, and welcome to the final session of this mental health, behavioral health webinar series. On behalf of the agency, we're glad that you took this hour out of your day to join us. Today's webinar is the final webinar in our series, and it's hosted by the TEA's mental health and wellness team members. I am Tammy Ginke. I'm the state coordinator for Project Aware Texas. We also have with us Ashton Millette, who's our state coordinator for the Project Aware Expansion Consortium. And then we have our director, Julie Wayman. Our team works in the Supportive Schools Division and focuses on school mental health and safety initiatives at the Texas Education Agency. We initiated this webinar series as a follow-up to our 6th annual Advancing Behavioral Health Collaboration Summit back in 2022. We wanted to take a deeper dive into many of the topics and resources that were shared by panelists at the summit, and also to promote and provide the fentanyl awareness resources to everyone. If you were not able to make the previous webinars, the recordings and supporting documents can be found on our website at schoolmentalhealthtx.org, and you'll go to the webinars section. Today, we're going to focus on 2 exemplars from the field who have implemented effective parent and family engagement strategies related to mental health within their school communities. All right, but first, I want to start with a bit of housekeeping. So we are using Zoom in the webinar format, which means that participants cannot show their video or share their audio. To ask questions, please use the Q&A function, and we'll do our best to get them answered. So become familiar with the chat function too, which I already see that 12 people are using. That's awesome. We're going to be dropping in some resource links into the chat for you as we get started and along the way during this hour. However, if you have any questions, again, I want to direct you back to the Q&A function that's going to be monitored for those questions. All right, so feel free to use the chat feature to say hello, to share any comments, share any resources, anything of that nature. All right, so we are asking if you'll just take a few minutes to complete this brief pre-survey before we start. So part of our mental health work at TEA is funded by Project Aware Texas through a federal grant through SAMHSA, who is the Substance Abuse and Mental Health Agency. And so the grant requires a pre and post-test surveys for our awareness sessions with stakeholders. We appreciate your support with this requirement. You can access the pre-session survey using the link in the chat box, or you can use it through the QR code on the screen. Please enter parent and family engagement in the box that asks you for the name of the training. So you can see a sample of that phrase on the screen now. So as we move along, if you don't mind, please completing the survey. And then after the webinar, we're going to ask you to complete the post survey. Okay. All right, so thank you for those that have completed the survey. If you have not completed the survey, feel free to continue, and as we move on with the presentation. All right, so today's webinar will be recorded and it will be made available on the Texas School Mental Health website. Recordings will be uploaded to the website in about a week or 2. So we will provide CPE credits for educators for today's 1-hour webinar for those attending the whole hour. A CPE certificate will be sent out tomorrow to the email address that you registered with. And this is the only way to get the certificate. We will not provide a CPE from TEA for the recordings. So finally, you can subscribe to the TEA Mental and Behavioral Health newsletter by using the link in the chat and selecting Mental Health, Behavioral Health tab. You can also select other TEA topics that interest you. We will continue to provide you with information and future dates of webinar sessions in that newsletter. All right, so now I will hand it over to our Director of Mental Health and Behavioral Health team, Julie Wayman, and she's going to kick off this hour of amazing learning.
Thank you so much, Tammy. Thank you all for joining today on this important topic. I'm going to take just about a few minutes just to set up the importance of what we're doing today on the next slide, Ashton. when you look at these statistics from the Youth Behavior Risk Survey over a period of 10 years, and you look at a trend, you can see with the first slide on the left why this is so important. Our students, 57% of our students, of our girls, and 32% of our boys are telling us that they are feeling hopeless, feelings of sadness and hopelessness in their life. Feelings of sadness and hopelessness helps lead toward mental and behavioral health struggles. It blocks our college and career readiness motivation, our goal setting, our ability to function in the classrooms. These are precursors to mental health warning signs that we want to pay attention to. Look at those strong trend lines up. With the chart on the right, where 28% of our girls and 15% of our boys felt like attempting suicide over the last year, and that was in 2021. We've also surveyed school districts last year, where school districts say that mental and behavioral health needs continue to rise, including behaviors of all sorts, including substances, anxiety, depression, and mental concerns. The isolation, the sadness, and the effects of the pandemic have accelerated these problems, which you can see were in place even before the pandemic. This is what parents are struggling with. This is why parent engagement is so important for schools. Next slide. When parents were surveyed right after the pandemic or during the pandemic, on the next slide, we can see that 31% of the parents share their concern that their children's emotional health is worse than before the pandemic. And this simply hasn't subsided to any effect that we've seen in any of the research or any of our interviews or engagement with our school districts. And so this is so important then that we can help increase awareness and partner with our parents and our families to help our children so they can get a vision for their future and succeed in school and life. On our next slide, I just want to bring you to a couple resources to let you know that at TEA, we do have a school mental health toolkit and practice guide. It was our first version out there, and I'd like everyone to consider downloading it if you just haven't taken a look at it, where the statutes in Texas for schools talk about parent and family engagement, talk about making sure we can identify early warning signs and notify and partner with our parents. And we talk about this through working with early mental health, prevention and intervention, suicide prevention, positive youth development, substance use prevention and intervention, trauma and grief-informed practices, PBIS, and building those relationships to manage emotions and responsible decision-making, and overall to create that safe and positive school climate. I want to look at you, tell you what the researchers put on the base of the whole framework was leadership and family and community engagement. If you're not doing that well, you're going to really have a hard time conceptualizing what you can do to bring families and schools together to wrap around our services and supports for our students. So you might pull down and think about what you're doing at your school and what you might be able to do, what might be possible. On the next slide, I want to say that summarize, Ashton and Tammy have done a beautiful job with recording this 6 webinar series through January, since January, this first half of 2023. I want to thank Tammy and Ashton on my team and all the presenters that hosted these series. Each one of them touched on the importance of family and parenting engagement, whether we were talking about resources for our mental health promotion and prevention and fentanyl awareness, whether we were talking about community resource coordination groups where we can plan and wrap around services with families, where we have a resource database in our state to help parents connect with resources for their students and their children, or community partnerships in the 4th webinar, where we talked about the importance of partnering with agencies so we can engage families and be able to communicate with our community partners to help our students get what they need. Or TCHAT, the telemedicine program in school, where with parent consents and coordination, we can get easy access to needed resources for children. And today we are wrapping it up with an intentional focus on parent-family engagement. I am so happy to say today that we have presenters that are going to share with us what they are doing with family and parent engagement. And I think I am turning it over to Libby to kick us off. Am I turning it over to you, Libby? To
I
kick
think
it off?
Lindsay's going
Or
first.
is it Lindsay? Okay, I'm sorry. I'm going to turn it over to Lindsay.
No
Okay,
problem.
awesome. I'm turning it over to Lindsay first with Conroe ISD. And Lindsay, can you introduce yourself and go ahead and lead into the important context of what you're going to talk about with Conroe Independent School District? Thank you, Lindsay.
Absolutely. Thank you so much for having me this morning. My name is Lindsay Taylor. A little bit about me and my role in our district is I help with assisted planning, implementing, and sometimes conducting professional learning and educational opportunities for staff, parents, and just our community. And it really is connecting with those outside organizations and entities and us working together. We work very closely with school administrators, campus counselors, and staff to help address issues surrounding unhealthy behaviors on our campuses or that our students are struggling with. I also act as a liaison between the school district and other public health, mental health agencies, our law enforcement agencies, family members, and of course, our students and our families. Our goals for today, or for me, is just to share the importance of family and community engagement in our campuses and our schools. Kind of what it looks like in Conroe ISD when we look at family and community engagement and what we did this past year, things that worked well for us, things that we are revamping or discussing to help further launch this even more with our families, and also the impacts that the family and community engagement has had on our families in our district. So really the why family and community engagement is important and what it might look like. These are just some guiding principles when it comes to family engagement from TEA, and the mutual responsibility of families, schools, and communities to build relationships. And I highlighted some words that were really important when we look at family and community engagement, because it's not two separate entities with the schools and the families, it's us working in collaboration with one another to support student learning and achievement, family well-being, and the continuous learning and development of children, families, and educators. Family engagement is fully integrated in the child's education experience, which we'll talk a little bit about how we integrated some of our family and community events with things that we did with our students on campus. It supports the whole child, and it's both culturally responsive and linguistically appropriate. And of course, it's part of our Texas Education Code that we involve our parents. Our parents have their rights and responsibilities. We are partners with them as educators. We have our local, SHAC, our School Health Advisory Council, that has really helped us this year, especially, and I want to highlight two events where our community really came together and really made an impact on the number of parents that attended those events. And of course, with parental involvement, we increase that parental awareness. And so with family engagement, we want to help motivate our families. We want to motivate them to help and reach out for support and obtaining that information and education. We want to empower our families by giving them the tools and resources and knowledge. There's nothing like even me and trying to continuously learn. I'll go to whether it's a webinar or a training, and the things that I learn from those, and some of it I may already know, and some of it's just new. It's so empowering for me, and I know it is for our parents to take that information and use it, whether it is to help their kids or their community that they're a part of. We know that working with our students and engaging our families is going to improve our student outcomes, and it's linked to better student behavior, higher academic achievement, and enhanced social skills. And so with this, kind of tied in some of TEA's information as well, but I like to think of it as the 5 C's of family engagement. We connect with them. We want to build that trusting relationship and respectful relationship. And it's all of us coming together. We may not see through the same lens, but it is having those conversations and helping support our families. It's part of communicating, sharing, and receiving information. That's one thing that we really worked on growing in, is really trying to advertise the things that we were putting on for our families regarding those educational opportunities. Collaborating and coordinating, working with families on our campus on common goals and making decisions for our students and our families, and conserving that relationship that we build, maintaining it and keeping it in a sound state. And so with CISD, I'm going to kind of go into a little bit about what family and community engagement looks like and what it's looked like this past year. I do kind of want to preface this that it is an ongoing, evolving process. And it's something that we are still continuing to work on. And once again, it's a never-ending task. Our families are busy. They have things such as extracurricular activities going on, work, childcare is something to take into consideration. And so those are all things that we have, as our department discussed, how can we further better what we're providing to our families. So some of the things that we've done, of course, is working with our Student Health Advisory Council. They've been an integral part in advertising, especially our last presentation. And I'll go into a little bit more detail about what we did this year. But we had an increase probably from about 30 parents at one presentation. The same presentation with our SHAC really pushing that information out and helping us with advertising, we had almost 100 individuals attend that particular presentation, the same one. And so they have been a really vital key to and even promoting some of the events that we have had. We've also done a series of community presentations. We've worked with schools and feeder zones with presentations, whether it's at PTO meetings, if they're at their family engagement nights, whether it's a reading night or a math night. And those presentations have really been tailored to the parents in that feeder zone or that campus, whether it's an hour-long presentation or even just short 10 to 15-minute bits of information that are easy for them to digest and take with them to utilize. And then, of course, I want to kind of highlight it was our first year to do this. And I know different districts have something like a university. We had a big community-wide event called CISD University, which was a one-day event, but I'll go into a little bit more detail about that in just a minute. So with our presentations this year, we had, if you look at the flyer, at the very beginning of the year, before it even started, we had already set aside a series of presentations and topics to present to our community and our families. I think it totaled about 12. But we covered everything from substance use. We had suicide prevention and intervention, addressing anxiety. We had one on grandparents, raising grandchildren, how to help make those healthy connections with our kids as parents or guardians. And then we also did one on social media and digital responsibility. Each one of these, we really tried to make sure that everyone had an opportunity to attend at least one of each event. So we offered them on 2 different nights in 2 different locations in our district. And if you know anything about our district, it is very big. We will have 69 campuses next year, and we cover over 384 square miles. And so it was really important for us to be able to kind of lower some of those challenges to get to those presentations. We also did what's called hidden in plain sight. And there's lots of different presentations that kind of have the same premise. So we bought a kit and we actually have 2. So we have a kit that mimics a teenager's bedroom with different drug paraphernalia and stash cans, where a teenager might potentially hide a substance or other devices. And so we set that up in our room. We had our audience come in, and it's almost like a scavenger hunt. Can they find all the items that could potentially be hidden spots? And so with that, the audience would go through that process, and then they would go to their seat, and we'd go through a presentation talking about the different substances, from alcohol, marijuana, opioids, even what it might look like in our community with the vape shops and locations, and trends in our community. I did want to highlight too with that one, we work on trying to provide not only just the location, but also presentations in English and Spanish for our families. So we had the opportunity earlier on in our presentations to utilize headsets that helped with we had someone translating the presentation live, one of our staff members, our crisis counselor. They translated that into Spanish while parents were sitting there listening to the headset. So they got the same information in real time. And so that was something we were really excited to be able to provide for our families. Another thing that we did is we had a speaker come out, Tony Hoffman. He spoke about his experience. If you're not aware of Tony Hoffman, he is a former BMX rider who ended up going to prison due to his use of substances and run-in with the law. And he ended up, once he got out, he set himself some goals while he was in prison. When he got out, he ended up going to coach an athlete in the 2016 Olympic Games. So he came and shared his experiences with our high school students. We got to all high school campuses, and that was in February. We also coupled that with our CISD University. So if you see on the right side of those pictures, we had our counselors come out, and we had what was called Parent U. Tony came and spoke at Parent U. We also had our district attorney and a parent come out and present on opioids and the law and the potential concerns with the use of opioids. And then in our Teen U and Kid U University, we had the opportunity to provide kids and teens things such as activities on managing worries and stress, digital safety and citizenship, kind of those more preventative aspects that could potentially couple with what we were talking about with our families as well. Another thing with Tony is he spoke at the high schools in February, and then that's where he was able to provide that parent presentation at that community event. So we covered both our students and our parents. And then he came back, or he was able to come back in May and also go to each of our junior high campuses. Another thing is the district attorney and the parent also were able to give presentations at two of our high schools. And then we also coupled that with, it's called NCOPE, Montgomery County Overdose Prevention Endeavor. And they have a walkway of people who have died due to an overdose. And so that was something that was also available to students and to our parents. With the parent and the student connection, we felt that it was really important that each of them got to hear what those presenters were saying. Another thing that helped really bring out our parents to these events is the fact that we had parents presenting or sharing a story. On one of the Hidden in Plain Sight presentations, we did have a parent come and speak about their experience with their daughter struggling with addiction. And so she got to share part of her story prior to us going into our presentation that evening. And I believe that brought in quite a bit. Once again, we saw an increase from 30 35 families who came to the first presentation to over 100. I believe it was close to 125 attendees at that one presentation. So we consider that a very big increase for our parents. Once again, we do feeder zones, campus-based presentations. Some hurdles, of course, have been that attendance, but we have seen when we work with communities and organizations, we have seen an increase in the number of our attendants. I know one of the things I keep asking, how do you bring in people, and food's always great, so we provide snacks. But really, it's been that getting the community involved and helping us. Our shack parents have been a huge help. Things that have worked for us, of course, is that community involvement. And of course, we're already discussing things to do for the new year. And so future things for us that we're thinking about to help even grow even more. And that's going to be our goal, is to increase our attendance for next year. We want to be able to, when our parents or guardians are already on campus or they're there for an event, how can we share that information with them, even if it's just 10 minutes? We've talked about PSAs. We actually did have PSAs on our jumbotrons at sporting events in the fall, looking at how can we share flyers and other different types of information, which kind of brings me to the next point, is utilizing our student clubs for things such as childcare, volunteering for events. They're always looking for volunteer hours, and they have been wonderful to help. They helped us with our CISD University. And so we're going to be looking at how can we utilize them more, whether it is going to those student events and passing out handouts or just sharing information that could potentially be educational opportunities for our students and our families. Advertising, once again, really helped, especially when we got it to different community entities. So we started with providing a flyer with all those informations, which we saw on the other slide, on just one handout, so that our counselors, families could go ahead and pencil those on their calendar. We did have a couple of dates have to change and topics have to change, but at least they had those in mind that they were coming up. And then we sent out flyers for each individual event throughout the year. And then something else we've looked at is just gathering more information from our attendees to help our feeder zones and schools determine what's working for them, what needs need to be addressed topic-wise, and also even advertising-wise. We started sign-in sheets for our families. They didn't have to provide a lot of information, just as long as we know that they attended, to get some data on how many attended. But also to help with our feeder zones, because I had campuses reach out to me asking, did I have any parents attend? So I was able to tell that campus, yes, they did have any, or no, because they're working too on their end on how they're advertising the information and getting families there. And then it's really the ripple effect. When we provide these educational opportunities for our families, we do see those impacts, and a lot of it we may not even see. But some of them with CISD University, we had the presentations, but we also had resources available there. So we had our mental health authority there and several other things that offered everything from mental health services, food and clothing assistance. We had the YMCA there. And one of the resources, or actually a couple of the resources, actually spoke to me about it being such a great opportunity for those resources to network with one another. And in my mind, because we work with them so often, in my mind, I thought they were all networking already together. Then I realized they each had a different role that they play in the community, from mental health services, the food and clothing aspect of things, and then even just the family and community engagement with the YMCA and other entities as well. It helps, once again, connect those families to resources. So our families were able to go around, collect information. And I know several of our campuses even provide their own resource fair for their families and with the surrounding entities or organizations in their feeder zones or their community. We're there to be a support for families. So a lot of times after our presentations or those resource opportunities, families come to us and ask where they can get more information or how they can seek more assistance supporting their students. So I think those connections are very vital. So we always provide an opportunity. We highlight that we have counselors there at our events. If they need to speak to someone, that they're there and we will wait, answer any questions that they have. And we have had families who have come up just to want to gather more information on supporting their student. And then, of course, providing education and information on other topics too in our district that we have, such as like our anonymous alerts or kid chat. We try to plug those into our presentations as well, because they are things our district offers. They're on our website, but just to highlight those. And I wanted to kind of highlight like the anonymous alerts, because when we talk about it in our presentations, then our families use it. So I've had families call and share kind of stories about them utilizing the anonymous alerts because of a concern their student had with a friend. And they were able to get them the appropriate support that they needed because they utilized it. So it's another way just to show the community what the district has and all the different ways we can support our students and everyone else in our community. And I just wanted to kind of end on this quote: parent involvement is more of a doing to, while engagement is a doing with. And so trying to move into more of that engagement and really working with our families and not just giving it to them, but really taking the education and working with our families is something that is an important thing that we can do to help just support the mental health needs of our community. And here's my information. If you do have any questions, once again, we're still fine tuning and growing, but I don't think it's a never ending process. So thank you so much.
Awesome. Thank you so much, Lindsay, for sharing all of the great work that Conroe ISD is out here doing to support that parent and family engagement. It seems like, especially from the chat, folks are already getting some ideas and those wheels are turning in their heads already. So I appreciate you for that, Lindsay. Before I pass it over to our next presenters, I do want to mention again that if you all have questions for our presenters, you can feel free to put them in the Q&A using that function at the bottom of your screen. And at the end of this next presentation, we'll hold some time to field some questions for our presenters. So again, if you have some questions that you might want to ask our presenters, you can go ahead and put them in the Q&A as we go along. So now I'll go ahead and turn it over to Libby, the executive director, and her colleague Becky and Christine Castle to talk about Austin recovery and the great work that they're doing for students and families who are in recovery from substance misuse disorder. So I'm gonna go ahead and pass it over to you all, and thank you.
Well, thank you, Ashton, and excited to be here. And like he said, I'm here with, my name's Libby Sanford, and I'm here with Becky, our parent coordinator, and then Christine, who is a parent, like an alumni parent, but / parent volunteer, and she's just really involved. And so we brought her for her expertise as well. So again, myself and Becky are right here, and then our contact information will be at the end. So first, I just wanted to start with a brief overview of our two programs, and then I'm going to turn it over to our parent engagement family experts, Becky and Christine. So we have two programs. We have a recovery high school, so all of our students are in recovery from substance misuse. And then we also have a youth recovery community. And so I'll go into a little bit more of that But again, that community is a really safe space for kids that are engaging in substance misuse and are exploring abstinence-based sobriety. So first I'll talk about the high school. So in both of these programs, we require parent involvement and parent engagement, just because that really helps fully support the student. And so for the recovery high school, some key aspects of that is we have a morning check-in. So just really creating that personal connection between the students and the staff. And with that, a really special part of that is the shared experiences that come out. I think we can kind of breathe easier when we know other people have engaged in some of the same behaviors or have had the same experiences. And so it can be really healing. And with that, there's acceptance and connection with staff and personal recovery. So a lot of our staff does have lived experience, and so they can kind of jump in and help coach the students and parents. And also here they have new experiences with being vulnerable and creating those connections. And so creating that safe space for both our students and our parents to really open up about anything going on in their lives that's causing turmoil. And then we also have individual academic goals. So of course, with high school, we have the academic piece. And I'll go into a little bit more of that on the next slide. And a huge aspect of what we do is in the healing. So really disengaging from unhealthy behaviors and unhealthy relationships, and really trying to increase self-worth and kind of healthy coping skills and things like that. And then lastly, University High School is part of, there's about 44, I think they've grown, but about 44 recovery high schools in the United States. And then our high school happens to be one of 7 accredited by the Association of Recovery High Schools. And then we are a nonprofit organization. So just quickly, our academic program, we have flexible and open enrollment. Again, we know our students sometimes come out of residential treatment in the middle of a school semester. And so getting them in as quickly as possible to avoid a gap in services. And this also really helps our parents in kind of trying to figure out next steps. And we can really get the student in the day they get out of treatment or what have you, or program. We partner with UT High School, and so they're really great about creating individual guidance for all of our students. They work really well with our parents as well. We also have a program where it's easy to transfer the credits they've earned. We are online learning with academic support staff in-house, and so there is someone here in person to help them with their academics. And also a big part of this is credit recovery. So a lot of our students may have engaged in substance misuse and it caused them to miss class, and so they ended up with incompletes or not passing a course. And so really trying to hit that credit recovery and helping them catch up in school. And of course, we have our academic staff that really communicates a lot with our parents and just keeps them updated on everything that their child's doing in school. So second, we have our youth recovery community, so YRC. So this program really follows an enthusiastic recovery model. And what that means is we really try to create an environment that's really fun and supportive, because we know that students don't quit substances just to be bored. So we create an environment where they have fun and they feel excited about doing things in the community and things like that. Meeting teens where they're at. So a big aspect of the youth recovery community is just meeting them where they're at, wherever they are on their journey. The student does not have to have the goal of abstinence in that moment. And so we work with them and try to guide them towards health and wellness, whatever that looks like for that student. It's non-punitive. We know that punitive measures do not work with substance misuse in teens. And so we really work with our parents on that as well. Informative and supportive. So we really try to educate our students through psychoeducation. Same with our parents. Becky does an incredible job leading all of our parent support groups and really educating them on different topics, which she'll go into. And again, like I said before, just creating that space where it's so fun that they almost forget about the drug use. And so just creating that really safe and fun environment. And just a little bit more about the recovery support services. So we really try to address multiple life domains. So that's going to be their home life, school, and community. So really helping them navigate those 3 domains. Again, with this program, we also have staff with lived experience. And so most of our staff have substance use disorders, or they have a family member that does. And so having that connection with our students can be critical. And each week for our students, we have 5 process groups. And then Becky will go into the supports around our parent groups as well. We provide recovery meetings, social activities, service opportunities for our kids. And then of course, individual brief interventions. And so we're not giving them therapy sessions, but we're really there in those kind of crisis moments. And we're there to kind of intervene and help them process that and then guide them to the appropriate resource. And then lastly, we really use a collaborative approach. And so we're just a piece of the family support system. And so we want to coordinate with all of the support systems in their life. And we really think that creates a more whole, well-balanced approach. And then finally, we do a lot of work with family systems and families and try to create healthy home lives. And I'm going to turn it over to Becky to really kind of speak into that.
Hi, I'm Becky Algram. I have a background in special education and also have worked at recovery high schools for 8 years, and then have had the wonderful opportunity of working with this recovery community, youth recovery community, as a parent coordinator for the last 5 years. And all of the things that you've heard, the services that we provide are really about creating this safety net of support. And I like this diagram because an engaged family is at the bottom. To me, that's the foundation. If the family is engaged and the parent and the teen feels that they have parent support, even if they don't like it, it makes a huge difference in the amount of time a teenager will stay engaged in recovery. So I think on the next slide, let me see. Okay, so yeah, I want to talk about some of the things that we know about teens and in recovery, and that is that that the teenage brain is really highly influenced by peers, impulsivity, higher likelihood of risk, all because their brain just isn't fully developed. And sometimes that is one of the most important things we talk about in parent group, is keeping that at the front of our awareness, is that our teenagers aren't making decisions as adults would make decisions. So I think that's one of the important factors of parents being in a parent group, is to kind of help have realistic expectations of their teenagers. We also know that there's a higher chance of substance use disorder developing if there's a family history, if there are other co-occurring issues, and if parents are available to monitor. When they're not available, then that's when teenagers sometimes are doing their own thing. And if they struggle with low academic achievement or lack of connectedness with school. And that's what we've found to be the ultimate antidote for substance use disorder, is connection. Mm-hmm. Substance use statistics. I mean, as you can see, there's a lot of information. We have a lot of information about what teenagers are doing. Some of the ones that really stand out to me is that 5 out of 10 high schoolers have used marijuana. That's very, very potent and very different than when I was a teenager. And then that 2 out of 10 students have used prescription medication, oftentimes not fully informed what's in that prescription medication. And I know you guys have heard a lot about all the fentanyl concerns. And one of the things that we're seeing is that 1 in 25 adolescents meet that criteria for substance use disorder. Mm-hmm. However, one of the things that are concerning to us is that not everyone's getting the treatment or the attention they need, the support that they need. So we're here in Austin, Keystone and UHS are in Austin. And so if there were if there were 85,000 10 to 19-year-olds in the area, we'd be looking at over 3,000 teenagers who are needing substance use support. And we average about 40 families a month. And increasingly growing, but the growth is not as fast as the teenagers' need is. So just kind of sharing that information. And so what we do know that are the obstacles is the family reputation, protecting that family from social stigma on all different levels. Across different cultures, it's a very hard thing for families to talk about a teenager who is struggling with substance use. It's emotionally painful and it's emotionally scary. So to be that vulnerable with other people is such a high risk. Also, their financial restraints. Treatment is expensive, and so is therapy. And thankfully, there are associations and organizations within different counties throughout the state that offer support, yet sometimes that just isn't enough. Or the parents aren't quite sure what all will be involved. And that leads to the last one, which is a lack of awareness of resources. And that's why I'm so grateful that we're talking with you today, so that you can help get the word out that we are here, our organization is here. And while the recovery school has a little bit of a tuition, our services are free to the families. The recovery youth community is free to the families. So on the next one, this is what we're hearing from parents when they come to us. Lots of times they didn't even know their teen was using drugs. Teens are very creative in a way of keeping it hidden. So when parents finally become aware of it, their teen has probably been engaged in drug use for some time. So they're not even aware of the frequency or the depth or the extensive amount of different kinds of drugs that teens may have used. They also have little to no support from their extended families, or they're afraid to talk about their child's mental health or substance use issues because I want to protect the child from the family, the extended family distancing themselves from them, which is a really a more common occurrence than you'd think. It's very sad to think that parents are so alone. When they come to us and they come to parent group, that's one of the first things I often see moms do is they simply just cry in group because they finally feel relieved to not be alone in this situation any longer. They often tell us that their marriages have been at risk, that this substance use disorder is a family issue, and the siblings are being affected, and their finances, ongoing therapy or treatment, repetitive treatment experiences can be quite costly, even with insurance. And they also say that they don't know where to start with addressing their teens' needs for recovery. So that's the things that they come in, and so the next slide is like, this is their priority. They come in and ask, how do I keep my kid safe? How do I keep my kid sober? And how do I keep my kid in school so that they will have a future, a good foundation for a future? And how do I keep them connected to people who are healthy and productive for them? And those are some of the main topics we talk about. So our main goal is assisting the family in rebuilding relationships. You know, you got to connect before you can correct. So how can you connect? And the parents, you know, sometimes the work is that we start working on ourselves as parents. So increasing self-efficacy, emotional self-regulation. It's impossible to really think that I, as a parent in recovery, who I am, and I've been a person in long-term recovery almost 30 years, I realized I could not help my teenagers regulate their emotions if I did not have any experience in the ability to regulate my own emotions, and definitely developing coping skills that look different than the coping skills we have seen in the parenting models we all grew up with. And so a lot has changed over the years. So definitely the parenting skills have changed. And then Healthy decision making, we talk about boundaries a lot. What does the boundary look like? Why do I hold boundaries? Is it just for my child? Is it the do's and don'ts for my child? No, actually, boundaries is more about what am I okay with? What am I not okay with? And what am I willing to support? And how do I communicate that in a calm, concise, and consistent manner? And then also better understanding recovery from substance use disorder. The recovery process can be very counterintuitive and sometimes confusing. So it's great to be able to come together as a group of parents and have a safe place where parents can ask, what does 12-step look like? What does smart recovery look like? What is my kid talking about when they're talking about working the steps or doing an inventory or looking at stages of change? And so that's where we do that work in the parent group. So this is what our opportunities, our services look like. We do parent support meetings. We have parent meetings 4 days a week. We have teen opportunities in the youth recovery program 5 days a week. And of course, school is 5 days a week. So for parents, we're meeting with them Mondays, Tuesdays, Wednesdays, and Thursdays. And so we do an education evening on Wednesdays. I'll show you a little bit more about all the different topics we're talking about. And then we do processing, where there are moms meetings and dads meetings. It was a real challenge at first to have dads engaged in this. They were kind of on the periphery. And when I said we're going to start having a dads meeting on our busiest night, we split up our time. Some of the dads started coming and they've been consistent. And so that's really great because they not only have a lot of concern about supporting their teen, but they're also asking a lot of questions about how to support their significant other while they as a whole group, as a whole family, try to support their teen. And then also under our meetings, I forgot to put under there, we have a new group, which is parents of young adults. A lot of our families are staying engaged with our organization, and the teens have built friends. This is their new friend group, and the parents as well have built friendships, and this is their support system. So we have a new online meeting that's for parents of teens transitioning out of high school and beyond. And then twice a month, we do multi-family group with the teens, where the parents and the teens come together, and we usually do a very fun or relaxing activity that's really built for building communication skills and collaborative skills. And then I make weekly individual calls for parents, and they check in with me at the same time. Just how are they doing? How is their kiddo doing? What's their relationship with their teen look like right now? What kind of supports do they need? And then, of course, parents call when there's a crisis, if there's been a reoccurrence of use, or if their teenager is engaged in risky behavior, sometimes leaving the house or hanging out with people they shouldn't be hanging out with. And then we also do a lot of social connections for the parents. We do a once a month family parent dinner. They drop off their kids at the youth group in the evenings on Friday, and then we all get together someplace and have dinner, and just to hang out and be social, because most of our time we're hanging out and talking a lot about our teenagers, but really trying to make an effort to just get to know each other as friends. And of course, we talk about the family dynamics. What does it look like in our family right now? And lots of times what parents end up talking about also is what their role was in their family of origin. And so that is just really significant, because when parents can start looking at what role models they've had for parenting, they start kind of unpacking that and are better able to make choices about the kind of parent they need to be for their child right now. And we talk about recovery, parent recovery, including the definition of codependency, which a codependent person is one who has let another person's behavior affect him or her, and who is obsessed with controlling that person's behavior. When we talk about parent recovery, and we talk about how the teen is focused on recovery from substance use, and we are focused on recovery from controlling behaviors. And instead of controlling and trying to fix things and acting from a place of fear, we start to learn how to be honest with ourselves about our fears and making choices about how we want to connect with our teenager out of respect and communication and concern, and how we communicate that. So some of the other topics that we talk about are these. We, like on a Wednesday night, education night, we are doing right now what we call the ABCs of parent recovery. And the discussions are amazing. Parents are asking lots of questions. They're showing up, tell me more about this. We connect it to their personal experience, their past experience. And to be totally honest, we're up to the ages. We've taken a nice, deep, slow dive into all of these. And it's just wonderful what parents are saying when they come back. They'll say, I talked about that with my teenager, or I listened to the other examples the parents gave about how they're using different ways of communicating with their teen, and my teen is starting to be less angry with me. That's always a positive thing. It's wonderful when they get to be a lot less angry. And we also do a lot of education about what substance use with teens look like. Sometimes parents can tell that their kid is off, but they're not quite sure what that is. So we do a lot of information about actual drug use and drug behavior. And what our parents would really like for you to know is that they are very grateful to educators and mental health providers who take the time to see their children as people and not treat them as projects. They also are becoming very aware that their relationship with their child is lifelong. And so this is a marathon, and for some of their teens, this will be a lifelong struggle for them, depending on the amount of focus they put on their recovery. And so they've come to look at having realistic expectations from their teen as their teen grows into adulthood, and of themselves. But they definitely continue to need your support and understanding, and that they are really working hard to learn more about recovery and substance use and mental health. Some of the parents come to me and tell me, have you heard this podcast? Have you read this book? They're into it. They're really involved, and they're very dedicated in letting their friends and neighbors who are also having issues know about the support that's here. But like we've said before, families aren't always ready. Here's some of the resources that we use. These are just wonderful resources. If you're a parent in the audience, the place I would start would be From Monsters to Miracles. It's a really wonderful little book that helps lots of parents understand what teen recovery can look like. Also, how to talk so teens will listen, and listen so teens will talk is super helpful about learning how to disengage from old patterns of communication and do something new. And the other books are great.
Okay. And I know we're kind of getting out of time, so I'll get to our contact. So here's our contact information for you all. Thanks, Becky.
Thank you.
Thank you, Becky. Thank you, Libby. Thank you, Lindsay. This is all just amazing information that has been shared today, and we really appreciate you coming here to share all the great things that you are doing regarding parent engagement. So this will wrap up our last session of our webinar series. As you will see on the screen, there is a link for the post-training survey, and there's also the QR code. If you don't mind, please complete that. And in that, you will type again the parent and family engagement survey there. And with that, we want to again thank all of our guest panelists today for sharing some amazing information and great resources. They have shared their contact information. So for any questions or anything like that can be addressed by contacting them. So with
Tammy,
that,
I'm sorry.
oh, go ahead.
I know we're kind of closing out, but I honestly wanted to, especially with Christine being on a call and being the parent leader with the Austin recovery, I kind of wanted to get her in too and kind of see if she has any experience you want to share about the impact of that parent engagement. I know we're at time, so you can feel free to jump off if you like, but I definitely want to make some space for you, Christine, to share any of your experience.
Yes.
Thank you, Ashton.
No, I'd love to, because I found Keystone and Austin Recovery to be fantastic for our family. My son Reese was about 15 when we found out he was using. I've been involved in the organization for about 4 years now, and we had no idea. Like when Becky said we were, parents come without knowing things, that was us. And he struggled with depression, anxiety, which I found I've yet to find a child with substance use disorder who hasn't struggled with something like that. And I think it's critical to understand that my son is like all the other ones pretty much that I know, he was using to escape the pain. He was using to escape feelings. He was not using on the weekends just to have a good time like a lot of the other teenagers. And he couldn't stop like other teenagers, but he has a biological disorder. And for parents to know that is extremely helpful, that it's not about willpower. And when we found out, we did not have any idea what resources were available. Eventually found UHS. And so Reese went to UHS for a year. And it was through UHS that I learned about Keystone. And that's where we started with them. Speaking on the parent side, since that's what the focus is, I found it to be just an unbelievable resource. I had no idea what to do. Counterintuitive is a word that he used, and that is so true. There are things like you think, well, I should be searching my kid's room, right? I should be, questioning them until they tell me the truth. And those aren't the best methods. And you learn the best methods by going to these parent groups. I think what I liked most about the parent groups, it's a sense of community. And it's amazing to think about the parallels between my son's journey and my journey, where he was seeking connection. He found connection. He found a lack of judgment. He found people who were going through the same thing as him. And that's what I found in the parent group. And that's what it's helped me, because I was one of the parents that came in and, prior to that, I was crying in my closet, not knowing what to do, feeling like I need to figure it all out or my son will die and it would be my fault. That's how it felt. And you come to these parent groups and you find out so many other parents were alone and feeling the same thing. And you can share the resources and the knowledge with each other, and to not be so isolated from all of this is fantastic. And we have developed a lot of friendships in that group, but I think just going and learning how to respond to my child instead of reacting. There are so many different stories that we will share with each other, and we all learn. So I've been there almost 4 years and I still go all the time, because there is so much for me to, if I'm not contributing with what I've been through, I'm receiving information. And there's an analogy that I found was extremely useful. And it was that if you picture your teenager that has substance use disorder to be kind of like a car that's pulling to the right. And so all the family is trying to pull to the left a little bit so we can correct. So your kid goes off to treatment, comes back, and your family system is still overcorrecting now, because you think you still need to correct for him pulling to the right. And he's actually received help, but the family system hasn't. And so it's not going to work, and so if the family system gets help too, it will help everyone go on the right path and help each other. But I'll try to keep it brief like that. So, and I'm happy to answer questions. It's been a fantastic resource.
Awesome. Thank you so much for sharing, Christine. And I know you all have your contact information out there. We'll also be posting it, this recording, all of the slide decks, as well as emails and contact info. So if you all want to talk more with any of our panelists, Lindsay, Becky, Libby, Christine, it seems like they're more than willing and welcoming to you all to be able to speak with you with that. So again, we appreciate you all for joining us for our final webinar session of this series. It's been a blast. And again, thank you for everybody who has been rolling with us over the last 6 months. We will hopefully have more sessions in the future. So if you haven't gotten a chance to subscribe to our newsletter, please do, because that is where we will be dropping the dates and topics for future sessions. So you all are, again, more than welcome to leave. I put the post-training survey in the chat as well. So if you haven't gotten a chance to do that, please do that survey for us to keep this session, to keep this series and this session continuing. So again, I appreciate you all and thank you.
Thank you.